Welcome back to the Girl Doc Survival Guide. Today I'm happy to be with Dr. Luiza Laborne Kalil, MD. Dr. Luiza Laborne Kalil, MD, is a dermatologist with expertise in hair loss. She trained in Brazil and subsequently did a postdoctoral fellowship at Yale University with Dr. Brett King. She's currently an assistant professor in the Yale Department of Dermatology. She was previously an assistant professor of dermatology in Brazil at Faculdade Ciências Médicas de Minas Gerais for 5 years. Welcome to Luiza.
Hi, Christine. Thanks for having me here today. I'm so happy to be here.
Thank you for doing this. Can you first share a personal anecdote?
Yeah, so both my parents are dermatologists in Brazil. So when I was growing up, everything in my house was just about skin. So all the dinner time, we were talking about rashes and everything. So when I was first growing up, I didn't want to be a doctor. I thought it was like their pathway, not mine. But when I had to come the time to choose what I was going to do, I couldn't think about anything else I loved and I wanted to do. So I ended up choosing medicine. But after med school, I tried to run away from dermatology again. And I really loved OB/GYN because who doesn't love the beauty of a baby being born? So I thought about it. But in the end, dermatology was always something that I really liked. So I chose dermatology. And now I'm really glad I did that. And I couldn't be happier. But it took a long time for me to admit that.
I think sometimes we don't want to do what our parents do.
Yeah, I love it. And I'm happy. And now I can discuss cases with them and we can go to meetings together. So I'm happy I chose it.
What do they do as dermatologists?
They both do general dermatology.
General dermatology. Are they in the same practice or same university or?
They work together. They both teach in a medical school and they both have a private practice, just the two of them in Brazil. They work together in both places.
You have to get along well, though, if you're married and you work together.
Yeah, for sure. It's a lot.
Yeah. Okay. You were born in Brazil.
Yes.
You first came to the US to do the postdoctoral fellowship.
Yes, correct.
Can you talk a little bit about your journey from Brazil to the US?
Sure. I finished med school and I did my dermatology residency in Brazil. And I was working there as an assistant professor for 5 years. And then I decided I wanted to do something else. So I started looking for postdoc opportunities online and I found this one at Yale. So I sent my letters of recommendation, my CV, and I got an interview. And then when I went for the interview, Dr. King was like, yeah, I like you. You can start, but I need you here in 3 months. And I need you to be a doctor here in US because you have to see clinical trial patients. So you have to have your license. And I was like, okay. And then after I hang up, I was like, whoa, how am I going to do that? Because I was a doctor in Brazil, but the pathway there is different. So I had to do all the USMLE steps in 3 months. And I had been out of the med school for almost 9 years. So I had to study everything again. And I was a full-time dermatologist in Brazil. So at the time, I have two daughters, 1.5 and 3 years old. I was doing dermatology every day. By the end of the day, I went back home and I was spending time with my family. And after they were gone to bed, I usually studied for 2 or 3 hours every day. And at first I was like, well, I'm not going to pass the test because it's just not enough time to do that. And I thought, if I don't pass, I'll tell him that I got pregnant or I'm sick. And then I'm not able to fly to US anymore. But then I did it. In 3 months, I did all the steps. And I came here and I did my postdoc and I ended up staying as an assistant professor.
That's amazing what you did. How did you find the energy to do that?
In my mind, I had two options to do it or not to do it. And I really wanted the opportunity. The only thing I needed to do was study. So I had in my mind that I had 3 months. It was hard, but it was for a short time. So I didn't think about it. I just did it.
At the same time, you had these young daughters, 1.5 years old and 3 years old.
Yeah, so I really thought about them because I didn't want to spend my time just studying and not playing with them and not seeing them growing up. I really wanted to make sure that I was spending time with them. And I just started studying after they were sleeping. So my sleep was like low for 3 months, short for sure, but just for 3 months.
How much do you need to sleep?
I'm a good sleeper. Usually I need like 8 or 9 hours. So it was really hard,
Yeah.
but I just drank a lot of coffee.
Some people in medicine, it seems like they really don't need to sleep very much. Like there are people who are okay with 4 or 5 hours of sleep on a consistent basis, but I'm not someone like that. I do need more sleep.
Yeah, I'm similar. And I always thought I wanted to be this type of person because really I could spend my time doing other stuff, but I really need to sleep. So sometimes it's harder. But to study, I had to do that. So we do what we have to do.
Yeah, I think that's true. We do what we need to do. And sometimes I feel like not really that time expands necessarily, but if I set a goal and I'm very serious about it, then somehow the time works out versus if I feel like I have a lot of time sometimes, then I waste it.
I'm similar. I work with like short timelines because you just have to do the things. So you kind of find the time to do it.
During that 3 month period, did you ever feel unmotivated to reach the goal?
There were some days that I really thought I wasn't going to pass the tests because they were really hard. And I had been out of med school for a long time. So I really had to learn a lot of things again. But I never thought about giving up. I just thought maybe I'm going to fail and then I won't go. But since it just depended on me, I really worked hard because it was my dream. So I wanted to do that.
How did your parents feel about you doing this?
They were really supportive. And my mother, she always says that she wants me to live close to her, but she knows that's not the best for my life. So she supports it. And they're really helpful. They come here into US often, like 3 times a year. They're here and they're proud. So I'm happy to have them.
Are they able to take time off like that easily?
Yeah, they have been dermatologists for a long time, so they have more balance today. They can take some time off and come here to visit. My husband was also very supportive.
Yeah. How long will they come for?
A week, usually.
Okay. Oh, that's nice.
Yeah.
And it's nice for your daughters.
Yeah. And during summertime, they are able to spend a whole month back in Brazil with them.
When you're here on your own with your daughters and your parents and your husband aren't here, how do you try to balance the work and the life parts that you need to do?
This is really hard because, of course, I want to be a good mother and a good wife and a good physician and also a good daughter. Sometimes it's not possible to give 100% to everything you're doing all the time. And I have really good people to help me. I have good friends. I have a good babysitter that's just really helpful. And she's here with my daughters all the time. But mainly, I just try to do my best. There are days that my daughters are sick and they need me, so my energy goes to them. And there are other days that I have had a difficult case at work. So I'm still thinking about it when I get home. There is no recipe in the end. Balance doesn't mean being perfect every day. I make my choices, and sometimes I have to be okay with the fact that sometimes family needs more of me, sometimes work does. And for me, sometimes just trying to have balance means that I'm trying my best, and that should be enough.
How did you learn that?
By trying and failing a lot of times.
I really love that you said, I just try to do my best. And balance does not mean being perfect. I actually think that very few people in medicine actually live that way.
As physicians, we are always trying our best and we study so hard that we always try to be as perfect as possible. But we're humans, so no one is perfect. We have good days and bad days, and it's okay. It's hard for us to admit that we are going to fail sometimes, but we do.
I think that there is a pervasive culture of we need to be perfect. And sometimes, not always, but even further, we can't admit to not being perfect. I'm so not perfect. We are, as doctors, just human, like you said.
And sometimes if you're not close enough, you just see the good parts about other people's lives. So it's even harder because you don't see that all everybody around us is having hard times sometimes. And it's okay.
That is true too.
Yeah, I'm not going to show the bad parts of my day in social media because who wants to see that?
Do you have tips on how you thrive in your career and in your non-career life? Because you seem so grounded and smart about things in terms of my best. That's got to be good enough.
It's not always easy, but I really love to work. So sometimes this is hard to try to find a balance. And there are times that I feel like I'm working very hard and spending less time with my kids because we have those days. But then I remind myself that they're watching me and they see that I'm working hard because I want to reach my dreams and I have goals. And no one can do that for me. So even the days I am busy and I feel guilty because I'm not with them, I think of it as an example for them. It's important for them to know the value of dedication. If you have a dream, you have to work for it. So it's not always easy, but that's the mentality I have. I'm working hard because I want it, because I have goals and I have dreams. And they have to understand that because it will be important for them in the future too. So I keep going to be a better mother and also a better physician.
Yeah. So smart. I think of you as very young, but I think you know things that I definitely did not when I was younger. I always knew that my kids are watching me because actually they see me at my worst. When they were younger, they were the ones who would point out my flaws, especially because young kids, they don't really have that filter.
Yeah, for sure.
So I always knew they were watching me, but I didn't quite figure out until more recently, I would say maybe in the last 5 years, what you said, that it is a positive thing, actually a very positive thing for them to see me pursuing a goal and being dedicated to it and really working hard for it and failing and trying again still.
This is really important because they have to know that we are working hard, but sometimes, even as we are doing everything we can, things just keep happening and we fail sometimes. And that's okay too.
Yeah. What has been the best advice you've gotten so far?
This could sound a little bit simple, but for me, I think the best advice I have received would be just to do what makes you happy because that is what really matters. Being happy gives us energy and gives us motivation just to keep going.
Yeah, I love it. Do you have any final thoughts?
Getting balance in life is really hard. And so, one thing that I've learned is to not spend more energy trying to compare myself with others because every pathway is different. We are all facing challenges along the way. In the end, we are all trying our best. I just think about the things that I want. I think about how I want to be in the future and what I want for my life and for my kids' life. And I just keep going without thinking and comparing it with others.
I like it. Thank you so much for doing this with me. It was really fun to talk to you about these things.
Thank you. I love being here.